Hi, this is Stephanie with a suggestion for you. And this video is just a video for parents of teens or preteens who are kind of wondering what to expect, what's typical, what's worrisome, what should they be concerned about, what kind of behaviors could they expect, and when to seek help. I hear a lot of parents sort of asking, like, is this normal, whatever normal is? Is this typical? Is this like what other people are going through with raising their teens? I mean, sadly, we're seeing a lot of teens struggling these days, and it's not surprising given the world we're living in right now, the uncertainty and the enormous amount of stress that teens face these days. You know, it's always been stressful for teens all through history. There's no denying that we all went through the stresses of teens. I guess the biggest difference would be for us is that kids are growing up knowing so much more about the world around them without having the maturity or sometimes the supports needed to handle that information. So it's really vital that parents stay really connected with their teens to really deepen that connection so that they can offer supports and help to their kids as they struggle through, the typical teen stuff, as well as the extra stuff that's being sort of thrown their way with a global pandemic and some of the other stuff that's going on these days. So, you can expect some increased moodiness, and there's a lot of hormones flying around, and brain growth and body growth. It's a lot. It's a lot for them to try to manage. I don't know very many teens who aren't, facing some kinds of struggles. But, if the connections are strong with their families, if they're feeling very connected to themselves, to others, then it shouldn't have to be as extreme. And if you're noticing intense and painful, long-lasting moods or panic attacks, self-harm, that sort of thing, then you're going to want to seek some help for that. But, expect some moodiness. They're growing, and it's a lot. And, with that growth also comes some self-consciousness as they're getting used to, the way that their bodies are moving now, and the changing of shapes and all of that good stuff. And that's all completely within the realm of, the typical experience. But if they're socially withdrawing, if they have social phobia or anxiety, if they're binging or purging, if they're trying to excessively control their diet, then that's a concern. You should seek help. You should seek a therapist. Another thing that you can expect from teens is increased dawdling. A lot of parents will get really, frustrated by that, especially if their kid wasn't a dawdler before. It seems like they don't care. And that's just not the case in most cases. It's the fact that they've got a lot going on in their brains and they're easily distracted. So, but it becomes an issue though if it's multiple distractions to the point of not being able to complete everyday tasks and not be able to complete schoolwork and homework and various tasks that they're being given. Another thing that comes up a lot, of course, is the increased parent-adolescent conflict. That one seems to be a little bit unavoidable, and it's perfectly, acceptable that they're going to question you. They're finding their own voice, and you go back to the moodiness of the hormones and whatnot. So, just being, understanding about that and accepting of the fact that, they're struggling and they're learning, and we just need to offer some grace and some love. Just trying to remember what it feels like to be in their shoes is helpful. A lot of empathy. When it's an issue, though, is if they become verbally or physically aggressive. If they're running away, those are not typical teen behaviors. Those are teens in distress. Hurt people hurt other people. So seeing their distress means that we need to get help. Seeing their distress tells us that we need to go and get some outside resources for them. Another typical thing is to experiment with drugs and alcohol and cigarettes. Teens do it. And, you're not going to stop them. Hopefully you're having lots of discussions around the dinner table about, the safety, concerns that you have about those things, but also that you're modeling what it means to, have boundaries around those things and have healthy respect for alcohol and maybe even cannabis, depending on where you live. So just modeling what it means to use those substances in a respectful and moderate way. And and just recognizing that they're going to try things, and it's the time that they're sort of learning about different things and what they like and don't like, and hopefully they don't like a lot of those things, but they're going to try. So try not to come down too hard unless it's an obvious issue of substance abuse, if they're selling it, if they're hanging out exclusively with other kids who use those substances, then that's a red flag and a sign that you need to get some help for your kid. Another thing that comes up a lot that you'll see in the teen years is this sense of being invulnerable, that you'll see them doing some risky behavior that you just kind of wonder, like, what were you thinking? And recognizing that they weren't thinking. The part of their brain that's in charge of logical thought isn't fully developed yet, and probably won't be until about age 25. So they're going to do some impulsive, silly things. Hopefully they're not too harmful. Hopefully they can learn from them without it being a huge lesson. But they're going to try some things, and they're going to try some things that we won't like. And so, talking to your kids about different risks and consequences is important, but also recognizing that they're going to do silly things and just trying not to shame them. Because we all did silly things when we were younger, things that we look back and we regret and think, oh man, what was I thinking? Like, we all go through that. That's typical. It's just like when it gets extreme, if they're having multiple accidents, if there's any encounters with firearms or excessive risk-taking, like drunk driving and texting while driving, those are all things for concern. And you should seek help for your teen if they're doing those kinds of risky behaviors. Some other typical things that you'll observe in teens is the stressful transition between middle school or junior high to high school. It's completely acceptable and expected that they're going to be stressed out during this transition time. It's a huge leap to go from the younger grade to high school. There's a huge amount of change socially and academically. We need to really support them through that time. It becomes an issue that should be addressed when there's school refusal or bullying or being bullied, lack of connection to peers and to the school truancy, failure or dropping out. Those are all cause for concern and should be addressed with some resources. We can also expect that our teens are going to become more argumentative. They're going to assert their opinions, and sometimes they differ from the family's opinions, and that's completely acceptable. They'll often criticize your views and your ideas, and there's a lot of idealism during that time as well. And that's all perfectly, part of the teen experience as they try to figure out who they are and what they believe in, what parts of their family belief systems they're going to, hang on to, and what parts don't speak to them personally. And so all of that's, beautiful and expected, and we really should be applauding that. It becomes an issue when they're not wanting to follow the norms and rules of society, though. Everything is a pushback and everything is seen as not applying to them, then that's an issue that would have to be addressed. Another typical thing for teens to explore, of course, is sex. arming your teens with the appropriate information for them, where they are developmentally, making sure that they know, safe practices, that they know about ways of being respectful and consent. Those are all really important and are things that you can share with them as a parent. Again, without judgment and without trying to shame anyone. Just kind of let your kids know. Let them know what you know, and then if you don't know, go find it for them. Both of my kids are LGBTQ. I really had no frame of reference to do a sex talk with my kids. I felt very ill-equipped to share with them, more than just, the basics of, how anatomy works, but also what to expect in a loving relationship, and that looks like, and what respect looks like, and self-care, and knowing your worth. And so what I did was I sought out the local bookstore that caters to LGBTQ folks and asked questions and bought resources there and took my kids with me to that store so that they could ask questions and find out what the information that they needed to know. It's not typical to see promiscuity, multiple partners, unsafe sex, and pregnancy. Those are all red flags and should be addressed. And, you should be looking to get your child some help if you're seeing signs of those things. Typical of teens is to become stressed by everyday decision making. They got a lot coming at them. It's constant. Kids have a lot coming at them these days. There's so much stuff coming their way, so much pressure within their peer groups, at school, at home. It's a lot. The brains just are so easily distracted. So let's just try to keep that in mind. It's an issue if they become paralyzed with indecision, though. Like if it's a daily thing, and if they can't make a decision on simple things, that's a sign that they need some help. Could be a sign of depression or anxiety. So, something to get looked at or talked about. And then also keep in mind that your teen is going to be looking for more privacy. And it's such a fine line. We want to give them the privacy that they need to feel comfortable in their own space, but we also want to make sure that they're still being safe. And we recognize that sometimes they're not able to make the best, safest choices at a lot of times, just because of, hormones and peer pressure and a lot of other things. Keep your kids close, but also give them some autonomy. Allow them to grow and develop into, the person that they're trying to become with some guidance. So if you see that your kid is isolating from, obviously your family, but also from their friends, if they're routinely lying and hiding stuff, those are all issues that you would want to seek help for. So it's typical for kids nowadays to have a strong interest in technology and social media. And I know that there is a lot of controversy about what that looks like, and I honestly don't know what the right answer is. As a person who unschooled her kids for a few years when they were younger, I always felt like they learned how to moderate their social media usage based on their interests, and that it waxed and waned when it was allowed to just be a part of their lives without any restriction. But that worked for us at the time, and I'm not suggesting that for all families. And I recognize that there's a lot of times when it becomes excessive. And when kids are spending more time playing games online than they are interacting with people in real life, then it can become a real issue. And so, there's a fine line because, we're living in a technological world. A lot of their social interactions are done online. But if they're visiting unsafe sites, or they're giving out personal information, if they're revealing too much to people, then that's a sign that there's something else going on, and you should maybe get some help for that. You got to find your own way with that. I think every family is going to struggle with that on their own, deciding what's appropriate and what's not. But I also think that when we have conversations with our kids about social media and the good and bad, when we watch documentaries on social media and the impact with them and have discussions about it. That way we can kind of keep in touch with them and let them know that, you know, social media is a part of our life. It's a big part of our life, but it doesn't have to be every part of our life. It doesn't have to take over, and it shouldn't. If you have a teen that's struggling with that, it's like any other addiction. It needs to be addressed. Why are they spending so much time online? Why don't they want to interact with other people in their lives? And then there's going to be hopefully some maturing that happens along the way, where they might recognize that their mental health is affected by their surroundings. And that can be discussions that you have as a family. If that's important to you, and you've recognized that you need a certain level of decluttering and cleanliness in order to feel, you know, comfortable in your home, then that's a discussion that you have. But recognize that not everyone would need that same level of cleanliness. For a few years, I just closed their bedroom doors. It was their space. It becomes an issue if if you go in and find like old rotting food or dirty, smelly clothes everywhere. Yeah, if it's really gross and stinking, that's an issue. And if they're not attending to their own personal hygiene, that's an issue as well. And it needs to be addressed. So, yeah, you need to figure out, you know, is this just part of their personality and they've always been kind of a little bit of a clutter bug? Like, yeah. So I'm not sure that that's a clear-cut one either, because I feel like individuals will vary greatly on cleanliness or not. But if it is disgusting and gross, or they're growing a science project in their room, then, you know, obviously that's an issue. It needs to be addressed. Not just for the hygiene part of it or the need for cleanliness, but also because what that represents maybe for their mental health. Lastly, the sleep schedule. So, you know, studies show that kids in their teens need more sleep, and that they typically go to bed a little bit later, and they benefit from being able to sleep a little bit later. So if your teen is turned into a little bit of a night owl, that's, you know, to be expected. And during lockdown, maybe they've become completely, I call my kids the vampires sometimes, because sometimes they're just completely flipped in their schedule. And I feel like maybe some of that was done on purpose. When you consider how many families have been stuck at home for at least some parts of this COVID pandemic, you'll recognize that maybe that's the only time that they could find some space to interact with their peers in privacy. So while mom and dad are in bed, or whatever parent situation they have going on, while the parents are in bed, they're up with their friends, and yeah, they can talk freely and not worry about being overheard or interrupted. And so, you know, there might have been a little bit of that. The kids kind of claimed the nighttime hours. And although we all know how terrible that is for their physical and mental health, you might have to let a little bit of it go. But then, you know, as we start to kind of get back into regular routines and whatnot, if it's still, you know, persisting and they're not able to, you know, change their sleep schedule in order to kind of get back into the normal swing of things, then yeah, that could be an issue. Like, so if your kid's sleeping all day and then staying up all night, and they're missing school, or they're habitually late, or, you know, missing out on family gatherings on the weekends and whatnot, that's an issue that needs to be addressed. We all remember the teen years as being tough years, and I think we need to really show a lot of compassion and acceptance for what our teens are going through, and recognize that they don't know everything. They can't possibly know, and we need to stop assuming that they know things. Even if it's stuff that, you know, we think, oh, they learned that in school. Like, you know, their brains are changing and developing so quickly that you know, things that we think are sinking in are just not, okay? So recognizing where they actually are is hugely important to being able to validate, accept, and just show empathy for our kids and help guide them through this tough time. If you have a kid who's struggling, seek help, ask for help. There is help out there. Finding the right kinds of help can be a challenge at times, but you know, if you keep asking, someone's going to give you the answer. You will get help. Forge a deeper connection with your child. Keep getting in their face in a nice way. Keep trying to meet them on their level. What are they interested in? What are they into? Try to be there asking them to do those things. And really just enjoy getting to know who they are at this phase of their life. And try to let go of some of the expectations that you have. Because one way or another, if they're given a lot of love, have a deep connection with their families and with their peers, they can really get through these years without it being, you know, a terrible time. And really it comes back to being there, not just physically, but being there for them, putting down the phones, really connecting, sitting across the dining room table with them and sharing your day and just being, you know, with them in the moment. As turbulent, as crazy as they can be, just, you know, buckle in, get on the ride with them and be their ally and be their guide. Just really try to practice a lot of unconditional love. And that's huge. Like, unconditional love is huge. It's the biggest part. If you can do that, I think you do okay. But if you've gotten past that point and there's been some damage done to your relationship, then, you know, it's not too late. We can get there. We might have to just, you know, work on communication skills and validating and empathy and what all that looks like so that we can really, truly practice unconditional love and radical acceptance, because that's really what's needed to get through these teen years, to just really accept them for who they are and where they are in their journey. So good luck to you all. Namaste.